Must you wear gloves when handling a non-critically ill baby or neonate? Let's talk about it. So in my previous video, I was shown, handling a neonate barehanded without gloves. And this was me adjusting the eye covering of these neonates with my bare hands. And so definitely there were some questions. I remember one particular question someone asked, no gloves. And I equally knew that there were some individuals who would ask that question, that why are you handling a neonate without gloves? Well, before we go to the natural logical reasoning behind such, we are going to go medically and we are going to go with research based and approved directions from the World Health Organization as well as the National Institute of Health. We're going to be getting information from them and seeing whether we should wear gloves whenever we are handling non-critically in units. And in what situation do you need to wear gloves, and in what situation do you not need to wear gloves? Let us see. Should you wear gloves when handling a unit, or must you always wear gloves when handling a unit? The answer is no. You are not universally required to wear gloves when handling a non-critically ill unit. The standard of care emphasizes bare-handed touch for the routine interactions as it facilitates essential skin-to-skin contact, promotes bonding, and supports neurodevelopmental care. Now, this is a research that is completely backed up by the National Institute of Health, the World Health Organization, the intcoglove.com, and prevent-protect.com. All right. Now, this, according to the World Health Organization and other organizations as mentioned here, gloves are only required in specific situations. Now, what situations are gloves required? Now, these are the situations when you must wear gloves when dealing with a baby or neonate as a healthcare provider. Now, they said that you must don clean non-sterile gloves during activities that involve a risk of exposure to body fluids, non-intact skin, or mucous membranes. Now, this includes, but not limited to, obviously, diaper changes due to heavy contamination with feces and urine, handling expressed breast milk or bodily fluids during feeding or if vomiting occurs, invasive procedures such as starting an IV, drawing blood, or placing a peripheral line, applying ointments, or dressing wounds. Anytime the skin is broken or non-intact, you must wear gloves. Now, these are some examples of situations where you are expected to wear your gloves when handling a baby or neonate. What about what situation should you not need to wear gloves when handling a baby or neonate? Let us see. Now, you should handle the infant with bare hands for routine care activities, provided your hands are thoroughly washed. Now, these activities include taking vital signs and doing physical examination. You don't need to wear gloves, but make sure your hands are washed. Holding, comforting, or providing skin-to-skin contact. Now, if you look at when I was holding the baby with my bare hands, there's nothing wrong with that. Adjusting it's just like you are trying to put on the baby's clothes, or even just adjusting the eye cover. The eye cover during phototherapy, there's nothing wrong with that. The baby is not critically ill. Assisting with oral stroke cup feeding, adjusting blankets or swaddling. You see, very important. Now, this is the importance of hand hygiene. Now, whether you are wearing gloves or not, strict hand hygiene is the most important intervention to protect a neonate from hospital-acquired infections. You must wash your hands or use an alcohol-based sanitizer immediately before and after touching the baby. Now, for those of you who may want to make your research, visit the World Health Organization, peernetwork.org, OVID, National Institute of Health, preventandprotect.com, and intcogloves.com, as well as some other websites. Make your research. So there you go, you've gotten your answer. You must not wear gloves in every situation you find yourself handling a non-critically ill baby or neonate. So whether you are a parent out there or a mother who is worried about how healthcare providers are handling your baby, there is nothing for you to be worried about. Okay, your baby is taken care of under sterile conditions. All right. And equally, if you're a healthcare provider and you've always been wondering, must I wear gloves in every single situation when handling a non-critically baby? You'll get your answer now. Now remember, this video is for educational purpose only. All right. Go to School of Health or make your research to be more educated on these things. As always, I'm Nurse Jonathan Zebuka, a registered nurse and a registered midwife. See you on the next one.